There's a lot of people who are in pain. A lot of people have medications for pain. It's not reducing a lot of that pain, but it is causing a lot of death.
More people die from overdose every year in America than do from car accidents. Overdose is the #1 cause of accidental death in our country, in our state, and in our county.
To put that in perspective, 80 individuals are dying every single day in the United States from an opiate overdose. That's 3 people an hour.
Yes, people are overdosing on heroin, and slightly more are starting to overdose on heroin. But the vast majority is still prescription medications.
And it's not about just heroin users. It's not just about a fentanyl user. It's about mom or dad who was in a car accident and is given 2 or 3 medications plus a muscle relaxer and something to help them relax. And all of a sudden they're not breathing at home. They didn't take too much medicine. It was just more medicine than their body could handle.
Being at risk for overdose doesn't mean you are doing something wrong. It only means that you may have been prescribed a potentially dangerous medication.
The vast majority of the things that people are overdosing and dying on do come from the medical community. They are prescribed by a doctor at one point, they are distributed through a pharmacist, and the perception is that because they come from medical professionals, they're safe. The perception is this stuff's safe, whereas the data says it's not. People don't get a realistic drug education.
There needs to be education on the risks of opioids. I've had patients come up to me and they've been on opioids for a while, and I said, well, you know, it is an addictive substance. And they're like, I've never heard that before.
Working with people, I have a lot of people say, oh, I don't know anybody who uses heroin. But if I ask them about, well, do you know somebody who has prescription drugs? They're like, oh yeah, all the time. They don't even think about that as being a problem. On average, there are 2 prescription bottles of opioids per household in Michigan.
Fortunately, there is a medication that will safely and easily reverse any opioid overdose, and it's called Naloxone. In this upcoming video, we're going to train you how to use a Naloxone Rescue Kit. We're going to train you how to save a life. So what is an opioid? Opioids are substances derived from the opium poppy, or with a chemical structure resembling it. Opioids can reduce pain and produce feelings of euphoria.
I think it's important to know that opiates is not just heroin. Opiate overdose is not just heroin. It can be a multitude of opiate medications where there's Vicodin, there's Norco, there's Oxycontin, there's fentanyl. There's all kinds of opiates.
So what are some common opioids? There's heroin, Vicodin, Norco, Oxycontin, and fentanyl. But there's also Percocet, Dilaudid, methadone, Demerol, codeine. The list goes on and on.
One of the key things to remember is that when somebody's using an opiate, whether it's legitimately as prescribed or if it's being used illicitly, they can still overdose.
So naloxone hydrochloride is pretty much a pure antidote for opiate overdose. It was created in the 1960s. The FDA approved it in 1971.
And naloxone hydrochloride is a medication which was designed specifically to reverse an opioid overdose. That's its sole use in medicine. It's very, very effective, very efficient, and very, very safe.
If somebody uses too much opiate, whether that was on purpose or accidental, then this medication can be given to reverse the overdose.
So when we take opiates, they target these receptor sites in our brain, and they tell our body to do certain things. They tell our body to feel pain relief. That's why they're, effective pain relievers. They give us that euphoric sensation, which is why so many people struggle with addiction. They tell our body, to start, slowing down our breathing a little bit. These are the natural responses our bodies have from opiates. When somebody overdoses, essentially our brain is telling our body that we have enough oxygen. You don't need to breathe anymore. So what naloxone does is it targets those same receptor sites, but it binds to them with a higher affinity than what opiates do, essentially kicking the opiates off those receptor sites.
It can be used on anyone that it looks like they're overdosing, and it's a medication that will not harm you. So if you used it on me right now, it wouldn't harm me.
One of the things that people need to understand about naloxone is that it will work on all opioids, any opioids, but only opioids.
If someone is using multiple substances, it's going to help you come out of the overdose for the opiates, it may not for the other substance, but then you're able to better evaluate the situation and see where to move from here.
If it's given to somebody who is not suffering from an opiate overdose, somebody who is not opiate dependent, it's going to essentially be like giving them water.
So it's an amazing drug, really. It's one of those where you can see somebody that looks like they're dead or near dead, and you give the drug, and they're better. And there's not too many things in medicine that do that.
Many of you may be thinking right now, how is this appropriate to me? I don't use drugs. I take my medication as prescribed. It's been prescribed by a doctor. It must be safe.
People are dying from overdoses even when they're prescribed opioids, and using them how they're prescribed. So it's not that they're abusing drugs necessarily, but they might still need this medication to save their life one day.
This isn't just for persons who do drugs. It's for persons who need medication, who have medication, who are really just following the treatment protocol that their doctor gave them, because we're realizing that the combination of our pain meds, our muscle relaxers, and our benzos really are a bad combination, and they can all lead together to stop the breathing.
Anybody who has a prescription for an opiate should have access to this life-saving medication.
Prescribe to Prevent, a website aimed at helping doctors prescribe naloxone, recommends that people meeting any of the following criteria receive the Naloxone Rescue Kit. Anyone who has received emergency medical care involving opioid intoxication or poisoning. According to studies, people who have overdosed before are most likely to overdose in the following 6 months. Suspected history of substance abuse or non-medical opioid use. There's an incredible risk of overdose in relapse. If someone has a history of substance abuse, they should receive an Naloxone Rescue Kit. Prescribed methadone or buprenorphine. Methadone and buprenorphine are both extremely long-lasting opioids and thus carry the same special risk. A higher dose opioid prescription. If someone is on a high dose of any opioid, they should have access to a kit. You should have access to a naloxone kit if you're receiving any opioid prescription for pain, in addition to any of these following points. 1. If you've been rotated from one opioid to another because of possible incomplete cross-tolerance. Switching from one opioid to another can be dangerous. Your body may not have the same tolerance with the new opioid that you had to the old one. 2. Suffering from a variety of respiratory illnesses or infections. Opioid overdose kills by depressing the breathing. If your breathing is already depressed, you are more likely to overdose. 3. Liver, kidney, or heart issues. These conditions can decrease your body's ability to process a medication, thus leaving more of the medication in your body for a longer period of time. And 4. Taking any type of additional depressant medication, whether it be benzos, sedatives, or alcohol. Again, opioids kill by depressing the breathing. Taking any other medication or alcohol that depresses the breathing is going to make it more likely that someone overdoses. Patients who may have difficulty accessing emergency medical services because of distance or remoteness. In an overdose situation, seconds count. Death happens from a lack of oxygen. Even a few minutes without oxygen can cause irreparable harm. If EMS are going to have trouble reaching you, you should have access to a Naloxone Rescue Kit. And finally, patients who just want to receive a naloxone kit. Naloxone is a medication that can do no harm. It can only help save a life. If you'd like to have a kit, or feel the need to have a kit, you should have one. Now we're going to show you how you can respond in an overdose situation.
So somebody who looks like they're going to overdose or is overdosing will start to have shallow breathing. They may have blue lips.
Tiny pupils, nodding out.
So they kind of start making this snoring noise, and that's kind of one of the giveaways that they're ODing.
People will breathe slower when they're really high, but it can be hard to tell when that breathing has gotten too slow, and so really the only thing that really separates those things is whether or not that person's responsive or not.
There's a whole range of symptoms that can look very similar if somebody's overdosing or if somebody's just very intoxicated on opiates. The thing we're looking for is if somebody is unresponsive. So, give somebody a little shake, say their name, you're not getting any response.
The way we teach people to respond to overdose situations is using the 3 A's: assess the situation, administer naloxone, and aftercare. We want to assess the situation to see if someone is overdosing. We want to administer naloxone to keep them alive. And then comes aftercare, providing rescue breathing, calling 911, and seeing whether another dose of naloxone is necessary. The first step in the 3 A's is assess. We want to determine if this individual has overdosed. There can be a lot of signs or symptoms that someone has overdosed. Their eyes could roll back. Their lips could be turning blue or purple, pale or clammy skin, vomit, foaming at the mouth, gurgling or snoring sounds. But the 2 key points are whether or not they are unresponsive or whether there is slow or no breathing. To see if this individual is overdosing, we want to see if they're responsive. A good way to tell if someone is responsive or not is to do a sternal rub. A sternal rub can cause a lot of pain without causing damage to the individual. Suspected opioid use plus non-responsive and slow or no breathing equals an overdose. You can call 911 at this point. If you are by yourself and a phone is not easily at hand, move on to administer naloxone.
Yeah, I'm with my friend. He's not breathing.
Someone dies from an opioid overdose because of a lack of oxygen, and even a few minutes without enough oxygen can cause irreparable harm. After we have assessed the situation, and we have reason to believe that someone is overdosing, we move on to the next step: administer naloxone. Again, we are going to teach you how to administer naloxone in its two most common forms, intramuscular and intranasal.
The Narcan comes in single vials. You just pop the orange cap off, you use an intramuscular syringe that we provide, withdraw the Narcan, and inject into a major muscle, into the thigh, to the butt, or into the shoulder. The muscular injection is going to take 3 to 5 minutes to kick in. In that time, you want to continue breathing for the person, making sure they're getting oxygen.
Intranasal naloxone comes in these pre-assembled nasal delivery devices. It is very easy to use and to administer. The first thing you will want to do is lie the individual on their back if they are not already. Tilt their head back slightly and gently press up on their neck. Wipe off their nose. You are now ready to administer your naloxone. Again, these devices are very simple and easy to use. Open up your cardboard box, pull out one blister pack, rip open the blister pack, removing the device. Grip the device with your pointer and middle fingers on either side of the nozzle and the thumb on the plunger. Really, the only way you can go wrong is by trying to prime or pressing the plunger too much prior to getting it in someone's nostril, thereby wasting the medication. Insert the nozzle fully into the individual's nostril until your fingers are touching the bottom of their nostril. Gently but firmly depress the plunger, releasing the entire contents of the device into one nostril. Naloxone takes 3 to 5 minutes to work. In that 3 to 5 minutes, the individual may not be breathing fully on their own yet. The third A is for aftercare. There are 3 important things you must do after you have administered naloxone. Call 911 if you have not already. Continue rescue breathing. Evaluate the situation to see if another dose of naloxone is necessary, and support your friend.
When someone dies from an opiate overdose, they're dying from respiratory arrest.
Their brain is not allowing them to be receptive to taking enough oxygen. Their muscles are so relaxed, they're not taking in enough oxygen. And if they just are doing rescue breathing and calling 911, there's an opportunity to save a life.
Rescue breathing is very simple. You lay the person on their back, you tilt their head back, open their mouth, pinch the nose shut, make a good seal between your mouth and their mouth. You give 2 breaths, you count to 5, give 1 breath every 5 seconds thereafter.
After 3 minutes, if the individual has not come out of the overdose, meaning they are not yet responsive, administer a second dose of naloxone, and continue rescue breathing. If after 2 doses of naloxone they are still not responsive, this may not be an opioid overdose. Make sure 911 is on their way, and continue caring for the individual. Many people are scared to call 911 because they are worried about getting arrested. In Michigan, many of our law enforcement officers are now equipped with Naloxone Rescue Kits and carry them in the community. In Michigan, we also have new Good Samaritan legislation, which protects you and the individual who has overdosed from arrest for personal use amounts of controlled substances, as long as the evidence was gained as a result of your seeking help in the overdose situation. Fentanyl is an extremely potent opioid. It can be thousands of times more powerful than heroin. Fentanyl can be dangerous either prescribed by a doctor or when heroin is cut with it, and people unwittingly use it. It is very difficult to differentiate between heroin and fentanyl outside of a professional laboratory. In a fentanyl overdose situation, it can take numerous doses of naloxone to bring someone out of the overdose. However, appropriately responding to a fentanyl overdose would be no different from any other overdose situation. You would want to administer naloxone, rescue breathe, and make sure you call 911. After the individual has come out of the overdose, you will want to support them. Giving naloxone to an opioid-dependent individual can make them experience withdrawal symptoms. This will not be pleasant for them. However, naloxone does not kick opioids out of the body. It just kicks them out of the brain's receptor sites for a limited period of time.
If somebody takes heroin and that's going to last where they say the half-life is, depending on what you read, say 2 to 4 hours. And then they have an overdose and they're not breathing. If they get naloxone lasts about 45 minutes, maybe an hour. And so that's the mismatch.
A lot of prescription pills are really similar, but things like methadone can be even upwards of 24 to 48 hours.
So the opiates tend to stay in the body longer. So it's really important with this medication that that person, once they get the naloxone, that they still seek emergency medical care.
There is the potential for somebody to slip back into an overdose after the naloxone wears off. More than that, the potential is with, when people use again after the naloxone's been administered, because maybe they are feeling a little bit withdrawal sick. It's really important to encourage people not to do that, because that's when the really big risk of someone slipping back into an overdose would occur. So.
If they don't know what it is and they're unresponsive, being able to use naloxone can make a difference, because it's not going to harm them by giving them naloxone if it's not an opioid. If they give them naloxone and they respond to it, then it was there. They had an opioid in their system. If not, it's also why we need to make sure that 911 is being called, because they need to be able to make sure that they are getting the medical attention they need.
You now know how to save a life using a Naloxone Rescue Kit and the Scare Me protocol. It doesn't matter what opioid you are using, where you got it, or how you are using it, or why. Opioids can be inherently dangerous substances, and they can lead to an overdose. You can't save your own life or reverse your own overdose, so remember to show this video to your family and friends, or whoever might be around when you are taking your opioid medications. Teach them to save a life with a Naloxone Rescue Kit too. By relying on each other, we can end this epidemic.